Thank you very much. Good morning, everyone. Before we get started, of course, I'd like to thank the Academy, the Hong Kong Academy of Medicine, the Hong Kong Jockey Club, and the Hong Kong Institute for Disaster Response and Preparedness for inviting us here. We're really excited to have the opportunity to share some of our experiences with you and hopefully to spark some discussion, as this is all a learning endeavor for us collectively. So. You might wonder why the Global Disaster Preparedness Center. I just want to say very quickly that the primary purpose of our center is to work with communities, vulnerable communities around the world, to help build disaster preparedness. And we do this primarily through our Red Cross and Red Crescent national societies. We have 189 countries that have an equivalent Red Cross to Hong Kong Red Cross or American Red Cross. And we look at these as our entry points to work through other partnerships and reaching communities. So that's why we're here, and you'll hear a little bit more about what we're doing as I go here. While we have an extensive community or extensive network, we have we oftentimes say we have 17 million volunteers. We know that this is not enough, that the needs that we're seeing around the world far surpass our ability to reach and address the needs as Red Cross. So thank you for having us, and let's get started. As you can see, we're going to be talking about building coalitions to enhance community resilience. And I'm not Omar. Okay, so I won't go too far into the details here. We've talked a lot about the global context in the last couple of days here. So these are just pressing issues that we're alert to, and I think the key point here is that they're all compounding one another. So there's not one thing that we can look at in a vacuum. And the needs that we're seeing, certainly through Red Cross operations over the years, are completely changing. So traditionally, we do a lot more in terms of rural settings, rural relief, and now we really need to accelerate what we're doing in urban settings, given the urbanization. And we have to be looking at local economies because they're so tied. They're tied from rural to urban, and they're complex. So we're just shifting our strategies and trying to accommodate so many of these challenges. So I'd like to take a moment to, from this I'm going to pass over to Omar to talk a little bit about a case study that hopefully will be of interest to you because of so many parallels to what could happen in Hong Kong, to some of the vulnerabilities that you might see in this landscape. And I'll come back and we'll continue to talk about a wider initiative that's going to draw from these experiences and introduce some new strategies for addressing some of the challenges that we anticipate in the future in all these urban centers around the world. Omar, thank you.
Thanks, Rebecca, and thank you all for joining us this Sunday morning. When thinking about this presentation and how we could connect the Hong Kong context to the materials of today, we thought we would reflect back on a case study from Hurricane Sandy. Superstorm Sandy, as it's called domestically, happened over 3 years ago now. And at the time, the infrastructure and the systems that had been established for response were completely compromised in the sense that while there had been great contingency planning and efforts to prepare emergency responders and different systems to be able to handle a major event, the actual impacts were beyond the capacity and the system's ability to absorb. And as a result, we had what was a major catastrophic event in New York City, which is a dense urban environment, a place where about 16 million people pass through Lower Manhattan every day for work. We have massive dependence on utilities and public transport. As you can see from this image, you have flooding in the subway, which is, thinking about the that volume of traffic that goes through and the dependence on livelihoods and opportunities to move from point A to point B being disrupted. The physical space that people require and use was really a key factor. So people live in small apartments. They require a lot of time that they do things out of doors. They spend time in congregate areas to fulfill part of their activities in their daily life. We recognize the vertical aspects of the response were really important. Thinking about the power outage and the ability to respond to people with disabilities or the elderly who lived above the first 4 floors. Their ability to move up and down is very limited. And as a result, there were people who were not necessarily directly impacted or injured in the event, but over the course of time, as power was not immediately restored, their dependencies become greater on existing systems, and the ability for responders was also limited. Thinking about the Red Cross response in these large building, very dense areas, the systems that the American Red Cross have are really designed for the middle of America, rural neighborhoods, where an emergency response vehicle that's handing out hot meals is equipped with 600, maybe 800 meals for one distribution. And that would take usually half of a day to distribute. But in an urban environment, you drive down one street, you've passed maybe 10 or 20,000 people. And so just the response mechanisms were quite different. Thinking about how to make adjustments in real time to be able to respond to things that weren't necessarily planned for was a key part of that response. There was also a recognition that the urban supply chains and economies are way more complex than anything that responders can put into place. If you think about what goes on in a day just to get a head of lettuce from the farm to the market, and all of the different pieces that are connected to make that happen. When you've disrupted the infrastructure in different ways, road access, utility disruption, fuel dependence, those systems become compromised. But they also are really resilient and can be prioritized to come back online, irrespective of response efforts. Social media and engagement is really critical. The volume of social media traffic explaining what is needed and also what opportunities there are for help and offers for assistance exceeded any expectation. The volumes were in the hundreds of millions of posts. And to be able to understand and dissect that information is pretty complex. And then the spontaneous volunteers is another thing that we really weren't prepared for as a response network. The outpouring of support from New Yorkers to other New Yorkers who weren't part of the formal systems was really overwhelming. Thousands of volunteers signed up to be put to work, but there weren't systems to put those people to work, and there weren't actually structures in place to be able to handle them. So thinking about the existing systems that we have, how to make adjustments for those for the future to quickly have tasks or opportunities to engage the community is really important. So I want us to take a moment and think about Hong Kong. And in Hong Kong, you have many of the same characteristics. You have the density of an urban setting. You have a very complex economy. You have a really incredible traffic pattern of people that are commuting from point A to point B on a daily basis to go to work, to do their daily activities outside of work, going to the gym or going to school. And those interconnected systems are all critical to how we function. Think about technology and just looking around, the use of smartphones, the use of social media, the way that you communicate with each other through different networks is changing every day and evolving. So while we were inundated with this reality in 2012, think about what it would be like if a catastrophic event were to happen here, and how we would have to prepare for that. And then know that, we've heard it over and over, that in Hong Kong there's a sense that, we're not all vulnerable, that there is quite a bit of resilience here, and I think that that's absolutely true. But in the case that there was a serious compromise to systems, how would Hong Kong people support each other, and what would the systems look like to engage volunteers and to be able to put people to work? We've seen the incredible network of volunteer opportunities and the things that people do as part of their the social good and their daily activities, and it's really remarkable. There's a real sense of purpose and contribution that exists among Hong Kong citizens. During an emergencies, those will just be heightened. So thinking about that as well. And then to go back to, just the overall kind of, just to draw for further comparison, to understand the I guess, maybe similarity to New York. If you ask people in New York before Hurricane Sandy happened, if they were vulnerable, they would say no. They would say that they were protected and that they didn't have those risks that they experienced, those vulnerabilities that they experienced when the storm happened. So I'm going to pass it back to Rebecca now.
Okay. So Omar alluded to this notion of a highly mobile population that you have here in Hong Kong. And what we're seeing across the world when we're looking at urban settings is the imperative for us to shift our thinking around community. What does community look like? When we are in rural settings, it's quite easy. You typically have some community leaders that are well-defined. Everybody knows them in town. Maybe there's a church or a mosque or, a few central schools, and it's very easy to zero in on the entry points to access people in need. And everybody seems to know each other, or there's, it's very organized and a far easier landscape. And even in that setting, we have a lot of challenges. When we look at this, it completely throws that paradigm. And so we're looking now at communities in your immediate environment, in that crowded apartment building. How many of you actually talk to your neighbors? I mean, I live in an apartment in Washington, and I only see a fraction of them. That's a community in your immediate household, in that neighborhood that shops at the local stores and that goes to the gas station or what have you. Then there's the commuting community. How many people take the same buses day in, day out, or the same trains to get to work in the same time frames. There's your school communities that you're tied to with other people that may have children the same age, maybe your parent-teacher associations, what have you. There's the work community that's probably most pervasive with people, tying businesses to these individuals. And then, of course, all the social things that come afterwards, different interests. But there are also hidden communities, and those are communities that we focus on at Red Cross as well when thinking about people you don't see in urban settings. Oftentimes the domestic workers, many of whom are unregistered or maybe have unaccompanied minors, maybe drug users. This is certainly a huge issue for us in the U.S. There are people that don't want to be seen or found, and these people are going to be disproportionately impacted by disasters when they occur. So I just raised this because it is definitely something that you as residents of Hong Kong should be thinking about, and thinking about entry points for influence. Who are your community leaders? We on a very superficial level, I think right away to the business community here in Hong Kong because it's so obvious, right? And those would be amazing opportunities for you to really do some outreach and explore some mutual interests around disaster preparedness for their interests around business continuity, keeping their businesses functioning, but also in demonstrating the commitment to their workers and care for their employees, to get them back working. We have ample evidence, which I'll get to in a minute, that by restarting that local economy, it's the fastest way to recovery. So I just want to mention that in this slide, and then that will transition into some of the other lessons we've learned. One around, I already mentioned, so redefining community, but then also really thinking about you as individuals, where you're sitting. You're going to be the first responders, people, just average people, before you're a doctor or a lawyer or a teacher or whatever you are. You're most likely going to be in a space where you're an individual first, and anybody that's in the vicinity of where that disaster impact is greatest will be the first line of defense. So this is such an important point because people oftentimes think that they'll wait for first responders, and you will lose incredible time in doing so. And the fact is, nobody stands still. Every disaster I've seen in the world or been a part of a response, whether it's a Pakistan earthquake or the tsunami or you name it, there's always an immediate response with the people that are affected. And so we need to change our mentality and not wait. While we have a great need to build the emergency response systems and to strengthen them and to ensure close collaboration and coordinated response and communications, all of those things are critical to a functioning response. But just don't leave out the community piece and this key element here when you're doing your planning. Another thing we've learned, obviously, is maybe stating the obvious, is just that the local and interventions seem to work best. And working with people that know their neighborhoods, they know their needs, they can help, they can quickly identify what the priority vulnerabilities are and what assets they have, what skill sets they have to bring to the table to help with some of the local solutions that may come out of that planning. There's so many examples on this, so maybe in the question Q&A time we can talk about that a little bit more. Obviously, for greater impact, we've got to be thinking about scaling. We've heard a lot about scaling in the last couple of days, and to us at Red Cross, this really means having simple solutions, simple strategies that can easily be replicated, they could easily be adapted, they are low cost, they inspire action. When individuals have this knowledge, they feel confident to actually employ something, to try something because they've, it's a simple enough intervention. So, and an example of this that we can get into too is just even having a first aid app in your pocket, where it provides you with key information on the most basic things, like what happens if you have a concussion, a broken arm, if you're impaled with something, to giving you the information you need to potentially save a life, yourself, your family, your neighbors. That's an empowering initiative that through technology is hitting some scale. So we're learning about this, but it's an intervention that we can talk about more as well while we're here this morning. The local economy, I mentioned it earlier. There's a huge growing body of evidence that's showing us that no matter what we do as government responders, as Red Cross response, any humanitarian interventions, it is not going to have the same level of impact as getting that economy up and running as quickly as possible, getting people back to work, putting purchasing power in their pocket so they can actually buy the things that they need and make those choices themselves, right? And this is, of course, assuming a functioning market. This isn't always the case when, certainly we're going to see situations where there are large-scale disasters and we need to ship in tents and food and other things. So it's one tool in our toolkit, but we need to be thinking about supporting that local economy. It also, as Jennifer Leaning mentioned in the first presentation, it helps return a sense of normalcy to a community when people are going back to work and resuming their routines. So obviously the emphasis on partnership here is so critical because none of us in our own capacities as institutions or individuals can meet the needs that we're seeing. And that's been a theme throughout this conference as well. So we're really excited to explore better ways to collaborate. And this goes well beyond financial contributions. I mean, there's just in fact, I would argue much more than that. More importantly is just this collaborative nature that we need to cultivate from the very local levels all the way up to national level and even beyond that. There's support structures that can ebb and flow like an accordion depending on the magnitude of a disaster. And we need to gear up and make partnership easier. And integrated programming is probably no surprise to those of you in the room here either, that we can't be looking at one sector in particular, whether it's health or safety or you name it. There's the importance of looking at the whole fabric of a society is critical, so that we don't leave out elements that are essential. A couple examples here. I think I want to mention the growing prevalence of using cash transfers, we call them, in an emergency response. This can take the form of, an ATM card and that's preloaded. There lots of opportunities here using vouchers and other things, so it doesn't necessarily have to be handing out dollars per se. But the idea is that in the immediate aftermath of a disaster, we as professionals cannot, through assessments, develop or come up with accurate assessments the way that individuals can address their own needs. So we have to treat people with dignity, give them an ability to quickly meet the needs that they face. An example of this, maybe when I'll use a personal example, when I was working with the Vietnam Red Cross out of Hanoi for Typhoon Ketsana years back. It was 2009, I believe. People had such diverse needs, whether it was caring for their elderly in their home and they needed medication, or they needed funding to send their kids back to school. Some people needed rice, not everybody. So there's so many benefits to using cash in an urban setting. Logistically, think about how much easier this is, where you don't need a supply chain, procurement, and the delivery systems and a transportation system that may be already impaired. An example of that is certainly with Sandy, where traditionally we're deploying stuff as well as Red Cross, and a lot of that stuff had to sit in warehouses. And we could have been more efficient with our time and giving people the resources they need to go to the local Home Depot or the other stores that we have in the neighborhood. So for an urban setting, this is really the future, I think, for emergency response. And there are plenty of mechanisms out there for checks and balances to see how people are spending. There's research that's showing how people are really putting that money to good use. It's, very few people spend it on alcohol and other things. When people are desperate, they're going to spend the money where they need to. So the first aid app I mentioned earlier, and Omar has been the lead, so I feel a little bit like an imposter talking about it here. But through our center, we've had the fortunate opportunity to work with the British Red Cross building out a first aid app that was a success in their country. And then in America, we adapted this tool. We have since been able to bring that tool to 70 countries globally. It's free to the public. It's through the Red Cross, so it allows the Red Cross two-way communication with all the people that download this app. The app provides, as I mentioned earlier, life-saving information, and it can announce first aid trainings. There's so many more things we can do with this platform, but it's an example of using technology to reach millions of people potentially in urban settings. And to identify them. I mean, we're just beginning to really understand how we can use this, maybe tie it to social media and identify community leaders in all the different places we talked about in urban settings. Community response teams. I wonder if some of this has already been done in Hong Kong. Unfortunately, I apologize, I don't know the setting as well, but we do see an effective intervention around the world in looking at building out community response teams. So looking maybe at an apartment complex here and saying who in this apartment would be willing to volunteer and learn light search and rescue techniques, learn triage, learn how do you safely evacuate a building and take on that responsibility so that in the unfortunate event of a disaster, they're taking action long before professional first responders get to the door and potentially save a tremendous amount of people. So there's lots of examples, too, that we can talk about there. So next, we're going to get into this somewhat lofty, grandiose initiative that sounds a little daunting. I have to say, when I first heard the target of 1 billion people, I thought, what are you talking about? How is that possible? This initiative is underway right now at the Red Cross, within the Red Cross network, It's been endorsed by our highest levels of leadership and will be announced in early December as the campaign of our future, essentially. This is going to be a massive undertaking that is aimed at establishing a new way of partnering well beyond the Red Cross. We want to organize ourselves better as a network so that we are building toward making communities safer and more resilient, but in tandem with hundreds of partners around the world, really trying to look at the commonalities of how we inspire behavior change. What are effective strategies? You can think of this partnering platform as a campaign of campaigns, so to speak. So many of the things that you're doing here in China, or Hong Kong and China, in the area, we can bring all of those things together to harness the power of that collective action. It is a call to action. And Omar is going to take you through in the next few slides some of the components as we build this out. We're very much aligning with the new UN Sustainable Development Goals that have just been released. So it may sound a little ambiguous or not so defined right now, but it's a work in progress, and we're really picking up traction. There's a lot of interest to participate in this, and I hope by the end of our presentation, will inspire you too to be a part of this effort. So without more on that, I'm going to pass it over to Omar to provide more background. Thank you.
Okay, so the 1 Billion Coalition for Resilience, for Community Resilience, as it's being called, is, as Rebecca said, a really ambitious initiative that's designed to tie together the different efforts that are actually ongoing, and to be able to help inspire different organizations to look to their neighbors to connect both locally, nationally, and globally, the different initiatives in order to achieve a common purpose. So here the vision, and I think it's worth reading. It's a world where all people are safer, healthier, and more prosperous, even in the face of adversity. So that's not necessarily just for disaster. That's for addressing a lot of the underlying UN Sustainability Development Goals that have been articulated, thinking about poverty, thinking about health, thinking about other core issues that underline the fabric of society in different countries. And that together, by 2025, 1 billion people throughout the world will be better prepared. And how do we measure that? How do we connect these different pieces? If you think about what 1 billion people, globally at average, that's almost one per household. So that's really, trying to reach everybody, and trying to reach every home. So how we measure that, how we articulate that, I think that's a work in progress. But it's going to be up to more than just the Red Cross to define it. It's going to be up to different organizations who are partnering to contribute and share how their piece is a part of this effort. So we have objectives here, kind of going down the slide, of collaboration, of need identification and assessment, solution generation, thinking about tools that can be shared, and how we can advocate. So thinking about influencing governments, influencing community leaders, influencing policy. And then what I think is the area of focus for the Global Disaster Preparedness Center is innovation and learning, and how that learning can be shared, and how we can learn from each other, and we can take innovations and really put them to practice. So we have different channels, whether it's locally, individual, or the household, different community and local organizations, national organizations, and the governments that support them or work closely with them, and then the different global and regional organizations that are meant to try to tie these different initiatives together as part of their their work, whether it's the UN or different global alliances that have been created to address segments of the work that we do. The principles that have been defined, we want to be coalition-based. We want to be thinking about partnership. It's a platform for partnership. And how we partner and how we work together to make those definitions is really the underlying concept here that the rest of the 1 billion coalition is built on. It's designed and measured for scale. So we're not thinking about just one community. We're thinking about communities across the fabric of our country, of our world. We want to be building on existing programs. We're not designing anything new. We want to be connecting what's already being done. We recognize that a lot of investment has already been made and that people have their own approaches and their own interventions. And arguably, they're all good. I mean, there are a lot of work that has been completed. There's a lot of initiatives. We saw Timothy's presentation from the Red Cross about the community work that's done in China. And it's remarkable how a consistent approach can be applied in different communities and effectively empowering different community leaders and community members to take action for themselves. That approach is one. Other organizations have others. And we're not saying that one should be ruled over another. We want to be locally led and locally resourced. So thinking about how that works, what is it that, and we'll show you an example of that in a minute. We want to link the global to the local campaigns. So the local campaigns are things that happen to inspire more first aid in schools, for instance, connecting that to this global initiative. And then do it yourself. How can we create tools that can be adapted and applied without the necessarily support of large government or NGO financial support? How can you put those tools to work on their own? The organizing model here, just to go a little bit deeper into it, and I like to start at the bottom of the slide. It starts locally. It starts at the individual or the household. Taking first aid training, taking, learning new skills, creating your family disaster plan, buying a kit or buying the elements of a kit and having it on hand. Being organized, knowing your neighbor, helping your neighbor. Local coalitions, thinking about what those neighborhoods are, those communities, and how those work. And then moving up the slide to the national level. How do these networks connect, and how do they translate into an opportunity to show progress that can be measured, that can be informative to the root causes that have been identified in different sectors, and then globally, telling the whole story. How does this feed into the sustainable goals from the UN? How does this fit into the really collective call to actions that we've seen from UNISDR and the Sendai framework? So for the sake of time, I'll just kind of let you see this and summarize how different root causes and vulnerabilities can be drilled down into actions, whether you're doing preparedness, whether you're addressing health, whether you're sharing knowledge, whether you're becoming organized and connected. And that, whether it's infrastructure that we're addressing or services, we have much to tie together. And through this coalition for 1 billion, we hope to be able to do that. So I'm going to jump 2 slides ahead to talk about a campaign for home fires that's being done in the U.S. right now. Working with the fire department, the fire services at the local level, the American Red Cross has been installing smoke detectors in households of vulnerable communities to address what is the most common and dangerous emergency that happens in the United States, and that's home fires. By installing the smoke detectors, it's an opportunity for community outreach to connect using this coalition model to educate the community and to actually make measured progress. The goal is to reduce the number of deaths by home fires by 25%. It's an ambitious goal, but through the actual concrete application of an initiative, taking it to scale by working in partnership with different networks, including government and fire services, it's possible. And it's just one example of the types of campaigns that can be connected. So I'm going to pass it back to Rebecca.
Oops. Yeah, okay, great. Okay, so we'll just give you one more example here. One that I really admire and I'm inspired by, and that is the Global Road Safety Project. I'm not sure if you're familiar with this project. It's certainly picking up speed on the international arena, but essentially this was something that was started by the World Bank initiative in 1999, and it is accelerating. And the whole idea is, as you can see, to really look at road safety as a pervasive risk around the world. Something that you know, some of the statistics, one in particular that stands out is roughly 3,500 people die daily from road accidents. And of course, this looks worse in other countries that are less developed, and it may be not as prevalent here in Hong Kong, but the impact that we see, like even in the U.S., by employing simple safety measures, just wearing helmets, for example, on motorcycles is just, it's remarkable the impact that we can have. So I like this campaign because it's really focused on something, simple interventions that we can do that reach scale in terms of impact. You can, let's just look at the top here so you can look and see what they're trying to do. While it's a global initiative, it obviously emanates from the local levels and the local participation and partnership. And that's where the first part here is talking about the needs that we see on the ground. Drunk driving, I mean, drinking everywhere around the world is a huge cause for accidents. So these are common themes that we're seeing throughout the world. And then delivering local solutions. So there are cultural norms that come into play here too. This is another reason why we need to be thinking locally, because we can't impose the value systems that we have in America all over the world, and certainly are not trying to do so with this campaign. So this notion of the local solutions and local discussions and dialogue and participation really helps pull out those things that are essential. Are women driving, for example, and who are the more vulnerable people in the context? And then who are the local businesses that can support the sustainability of this intervention in the campaign? So while the Red Cross Network is a key partner, there are so many others now, including a lot of UN agencies and businesses like petrol businesses, Chevron and such. I mean, there's a whole list of partnership. I encourage you to get online and Google this, because it's really something that, to me, is an example of a partnership or coalition campaign, a call to action that can easily fold up under the 1 billion coalition concept. So we take that more less defined or more vague concept maybe that, there's still a lot of questions around, and we're trying to bring it down to a meaningful illustration of what it means when it hits the road. And this is the kind of thing that we're trying to pull together. And then city-level decision makers can prioritize and look at all these tools in their toolkits. There are so many campaigns that are already packaged and ready for use out there that we could provide through this coalition. So, the emphasis is really on changing community behavior through education and training, and that's what we're trying to get at, human behavior change, which is arguably the most challenging thing we'll ever do. But so let me stop there and just try to wrap this up a little bit. I think, let's see, whoops, that's not coming up here, just a second. before we open it for questions, just reflect on what we've shared here and think in your own professional capacities or personal interests, how does this information, what we've just shared with you, really apply to the context in Hong Kong? You know, and what can you do tapping some of these resources that we have globally, these campaigns and other initiatives or partnerships, to transform Hong Kong, to be proactive and inspiring some change here, educating decision makers so that they're informed with good information to make better decisions and how they prioritize scarce resources. We're all facing scarce resources, so it's not just in terms of money, but also our time. And incredibly, you know, Hong Kong residents are very, very busy, so we need to have a listening audience, an audience that's empowered to take action, and that's a really, you know, that's a first step, is informing the decision makers and inspiring some change at that level, and then figuring out how we reach communities in a place like Hong Kong. And what would you suggest? I'd really love to hear from you more in the next, we have 15 minutes or so left, and it'd be interesting to hear your reflections, and certainly Omar and I are happy to take some questions now. Thank you.
Can we have one more chair here so that the presenter can sit and answer the questions? Oh. We have a volunteer.
Thank you. That's right. Thank you. That's nice. Appreciate it.
Yes. Yeah.
Thank you.
Yeah. So thank you, Rebecca and Omar. Last year we have the funding from Hong Kong Jockey Club. That's why the Hong Kong Academy of Medicine can form this disaster preparedness and response institute. So one of the major objectives to form this is that we want to call upon all the non-government organizations, which are voluntary organizations, that we can group together and then to discuss about preparedness, including how to enhance the community resilience during a major disaster. As all you, most of time, you agree with me that Hong Kong is very fortunate that we do not have any major disaster happen in Hong Kong, apart from those typhoon accidents many years ago when I was still a kid. Okay, and I think one of the very important points about your presentation is about the to increase our awareness of possible maybe domestic accidents. Okay, that can be, if not under well control, will be enlarged to a major regional disaster. For example, a few years ago we have the Gary building fire. Okay, if we have more awareness, your home fire, how people will respond, I'm sure that the casualty, the number of mortality will decrease drastically. We have quite a number of deaths in that accidents. Yeah. So without further ado, I would like to open the discussion to the floor. I can see some of the our collaborating partners are here. Okay, including the AMS and others. So anyone would like to? Okay, Betty, from Hong Kong Red Cross.
Thanks, Mr. Lau. Is it working? Okay, and it's a very inspiring and educational presentation. And it's more like a comment than a question, and I think we would really like to stir up the discussion. I think in Rebecca and Omar's presentation, it mentioned that we need to redefine communities in an urban setting. And I think we also maybe need to redefine disaster in a urban setting. Because in Hong Kong, when we say we are fortunate and we don't have many disasters, we are actually referring to those big-scale natural disasters. But in fact, from the presentation I just heard, we need to be more aware of the risks. For example, in a highly urbanized setting like in Hong Kong, power cut is a big disaster to all communities, and how we are going to respond to that kind of risks in the community. I think that's one thing. And the other thing is in the distinctive difference between the urban setting and a rural setting is really about the role of the government. And in many of our past experience in relief operations, we see that the government's role in the urban setting is much bigger than in a rural setting. So where by convention, the community may be more dependent or counting on the decision on the central government to respond to a crisis. That's where we really need to build the individual resilience and community resilience to be more autonomous, in fact, in the urban setting to respond to risks as we identified. I think we would really like to hear a bit more examples from other urban settings where we can, put together community resources because they are very resourceful and very wise people to respond to major risks in the future. Thank you.
Uma?
So just one comment. I think, Betty, your point is really excellent. And the idea of redefining disaster, what we consider to be the risk or the vulnerabilities is really important. Just an example to emphasize how that perceived dependence on assistance from government is not necessarily realistic or real on people's daily life. They are independent. They are operating without a hand necessarily from first responders or from the government authority. They're actually getting from work to home to the grocery store to take their kids from school. They're managing a very complex environment, and that the uniqueness of every individual's day together is something that we need to account for. And by providing the DIY, the do-it-yourself tools, and the encouraging that opportunities to become more resilient, you're just influencing that and building on that independence that already exists.
Rebecca?
If I may. Oops. I'll use this one. So if I may, I would just add something that I think we also need to think of in urban areas where we have this perception that people are independent, and they are in their day-to-day lives, but oftentimes people in rural settings are used to having to survive on their own in hardship. And I think in an urban area, so much is at our fingertips. If something happens to you, you just go down, the store's within 2 minutes, everything's available. We're so resource rich in a city. So that when something happens and those systems fail, people are at a loss. They sort of freak out, if I can say in our slang. They really don't know what to do all the time. And we saw that with New Yorkers, where they are highly independent people, very, very well educated by and large, and very successful in their respective careers and such. But I tell you what, after that disaster, after Sandy, it was a humbling experience, and people did not have everything at their fingertips. And then this other notion that that we have to adjust our thinking around how do we do pre-positioning and preparedness in an urban area where, like Hong Kong, your apartments are so small. So what can you actually keep in your apartment? Can you keep 3 to 5 to 7 days worth of water and food and all of this? It's not practical. It's not real. Right? So we think, okay, maybe at the end, we just have to adjust our thinking. There are solutions available, but we have to shift how we prepare from a rural to urban area.
Yeah, not even a torch.
And the perceptions, exactly.
But it's good that we now have the smartphone. That we have the torch.
Thank you. Thank you for the talk. Volunteering is very important in disaster response. And however, volunteers have different abilities as they come from all walks of life or different parts of community. So and sometimes they may be too energetic, to give help. And so how to manage volunteering to ensure the success of disaster response? Thank you.
Thank you for your question. We grapple with this all the time as Red Cross. Our network is reliant on volunteers. It's the heart of our network and how we do our business. In a major catastrophe, one of the ways that we found effective to deal with the immediate aftermath of a disaster is to link our trained volunteers with the spontaneous volunteers that came to the scene. So in the example of Sandy, one morning I was in a parking lot actually communicating with Omar, and I had 500 people show up, to respond. And of that 500 people, maybe 25% were Red Cross volunteers or had any affiliation with Red Cross. So we tried to do a buddy system so we could take those that are trained and understand the risks and the security concerns and all the other things that are appropriate for dealing with people affected by disaster, psychosocial services, that sort of thing. That we want trained people linked up to the extent possible with lay people. It's not always possible. And there are plenty of times where we had to send teams out for outreach that were not trained. But it's better to do that than to turn people away most times. I mean, I don't think there's a simple solution for every context, but it's just one example of how we tried to address that because we don't have the resources to train everybody. And I'm sure Betty would agree that Hong Kong Red Cross would be very strained with that expectation for Hong Kong. But if we are strategic about how we do our training and have some representation throughout the city and that sort of thing, there are ways that as Red Cross we can do a better job in making sure that we have better representation with our volunteer structures. And let me pass over to Omar too. I think he has some thoughts.
I was just going to say that maintaining relationships with volunteers is one of the most important thing for organizations like ours that really are dependent on volunteers, but there's a responsibility to keep them engaged and keep them active. And the reality is that during a major crisis, the number of volunteers you need is different than the number of volunteers you need on a daily basis. And so the systems that you have to have in place to account for that are things that you need to plan for. So creating buddy systems or plans or strategies to empower volunteers to be leaders or to do quick intake of new volunteers and put them to work is something that we learned as a real lesson from the Sandy response, where we had tens of thousands of people signing up to volunteer and systems that couldn't account for that number of that amount of interest. And that goodwill is there for a fleeting period of time. And you want to take advantage of it, and you don't want to disappoint the public because you want them on your side. And so creating those opportunities and planning for those opportunities are important. And to do that is hard. It's complicated.
Otherwise, the volunteer will be adding chaos to the already very chaotic situations. You want to follow up on questions?
Yes.
Okay, last one for you.
Just some sharing. We need training. I think, from my view, we need training of healthcare professionals or disaster workers on how to work with the volunteers, how to coordinate the emergency response. Say we know how to deploy them to oppose fitting their abilities and how to correct their mistakes without making them upset, and how to give feedback, encouragement to good attitude. So I think if we can have a proper training of our healthcare personnel or disaster workers, as well as if we have some organized training of our volunteers, then I think during in disaster response, the effect can be much enhanced. Thank you.
Okay, I'll assure you that DPRI will collaborate with all the NGO partners to work for this direction.